Epilepsy, it's a disorder which constitutes an episodic phenomena where a person gets an episode of tonic movement of the body followed by loss of consciousness, that is called commonly as Virgika Dora in the Indian context. Now, epilepsy is a disorder. When a person gets a seizure, you can say he has a disease, but when he is not getting a seizure, he is like any normal individual, any normal person. He can do all his routine, or he or she can do all his routine activities. So epilepsy is a disorder which actually should not be looked from an angle that it's a chronic disorder, progressive disorder. It's a disorder which can be very well managed by various modalities of treatment which we have today. And if we are talking about epilepsy in society at large, now we have seen advent of so many new options as far as medicines are concerned, new drugs are concerned, the safety profile of the drugs are concerned. They all have really come to a great benefit to all our patients. Now, important message is that the main reason why you should take proper treatment is that once you take the treatment for considerable duration of time, that is recommended duration as fixed by a clinician depending on the individual's profile, then the chances of getting repetition or recurrence of seizures are much less. Now, if medicines do not work, there are so many other modalities or options which have been developed in the science. So if we talk about epilepsy surgery, we talk about stimulation, or we have to talk about some placement of electrodes in the brain, they all can help to improve the quality of the life and getting the control of the seizure. When we talk about epilepsy, it starts from the childhood, at the day of the birth of the child, right up to the, can last up to the end, and the person who is at the fag end of his life. But the very important domain of society is women. Now, women, they are different from men because of various reasons, as we all understand, because of hormone changes and their physiological constitutions. So, when we talk about women, we talk about from a child, a girl, then become adolescent, then a woman, and then postpartum phase. So, most important phase is before the puberty and the childbearing age group. Now, here we have to tell the girl or the female that epilepsy has to be controlled on the priority, and it is the responsibility of the clinicians and my colleagues to look into the options of giving treatment for a woman, and the best possible, the one drug which is least likely to produce side effect in the women should be recommended. And if the treatment profile and the patient's response and adherence to treatment is proper, I think women can get rid of this epilepsy with slight change in the modification in lifestyle and regular medication. So for women, there is nothing to harass them. They should not worry about the epilepsy because this can be very well managed. Now, when we talk about the women in society, there is always a problem or stigma associated with epilepsy. It is considered to be a psychiatric cum neurological disorder. Actually, of late, the Neurology Fraternity of India has been able to take that section out of the law. Now, it is no more criteria for getting a divorce. So, marriages should not be affected by epilepsy. So, if a girl or a boy is having epilepsy, it is like any other disease which can be very well managed. So, it should not be a reason to discontinue or disharmony in the marital relationships. So, it is important for us as clinicians to tell the society that this is a disease which can be conquered by a combined effect of everybody, the patient, their relatives, caregivers, clinicians, social aspect of that. All have to intermingle and come to a platform where these patients feel that we do not have a disorder which can affect our social or personal relations or financial integration. So I think we should all come together and we all stand together to give a good quality life to our patients, and wishing all the best to the patients who are suffering from epilepsy and their caregivers. Goodbye.